I'm here with epidemiologist Bonny Specker, who is going to give us an update on what has been happening with COVID-19 in our area, in the state, in the nation, and in the world over the last week. Bonny, how are things looking when it comes to COVID-19?
They're looking pretty good, Chelsea. I'd like to go through this. I just have a couple caveats at the end, but I think they are looking good. Um, but Brookings, we are out of substantial spread. We have been. This is our third week of being in moderate spread. It's inching up just a little bit, so we need to be sure and be aware of things that we can do to keep those numbers down. But last week, we had 31 new cases compared to the week before we had 28. So you can see it's just bumped up just a little bit. We've had a total of 3,630 cases. The hospitalizations, we only had one of those last week compared to 3 in the week before, and we didn't have any deaths last week, which was also good. We had one the week before that. So you can see the hospitalization data, we are down. Let's try to keep that at 0 for a while. If you look at vaccination data, and this data really does not reflect the percentage of the county where the eligible population has been vaccinated. So Brookings tends to run lower than the rest of the state because our population on average is younger, so we have a smaller percent that have been eligible. Now that they've opened up the vaccination program to everyone in that 1D category that I know you post on the city website, our percentages should be going up much quicker because now a lot of the college students who live in the dorms, they'll be able to get vaccinated as well as a lot of the staff at the university. But 25% of South Dakota residents have received at least one vaccine. This does not include IHS and the VA, so it's probably higher than that. Brookings County, close to 19%. Fully vaccinated, close to 14% for the state and 9% for the county. If you look at the state, the cases, we've had 113,962. You can see the state can't, for some reason, get below that substantial spread. We have been fairly steady for the last 6 weeks, but it's still at a pretty high level. So it would be nice to see that drop more. Last week, we had 1,129 new cases compared to 1,025 cases the week before. As far as hospitalized people in the state, there are currently 73 people hospitalized. This is as of yesterday. 14 of them were in the ICU. We've had 6,736 hospital admissions. For the week ending yesterday, there were 82 new admissions compared to 84 in the week before. So just like the cases, this parameter tends to be fairly constant at a somewhat high level. Definitely not as high as November, though. If you look at deaths, we've had a total of 1,904 deaths. And this dropped quite a bit last week. We only have 11 deaths reported for the week ending March 10th compared to 29 in the week before. That's still a pretty high number when you're talking about deaths. So I did add one slide this week that will be in the weekly updates, and it lets people look at what percent of the population in the state has received at least one vaccine by age. Since it is affected so much by age, and we've started vaccinating the older people first and are making our way down, I think it would be good to show these data and see how things go over time. Here, just to show you how to read it, this is saying that 38.5% of the 60 to 69-year-olds have received at least one vaccine. So we have close to 72% of people above the age of 80 have received at least one vaccine. You can see that it has dropped, and a lot of this is due to it being open to these older at-risk people earlier. These people down here in the younger ages are likely the healthcare workers and the first responders who were also vaccinated early on. These data do include the VA and IHS, or the Indian Health Service data, and that's because it's available on the Department of Health dashboard with those data included. So this will be a good thing to watch. Hopefully we can get up to 80% or greater in these different age groups and get closer to that level that's required for herd immunity. If we look at newly diagnosed cases in the US, we've had 29.8 million cases, and this has dropped. Also, last week there were 430,000 cases compared to 464 new cases the week before. So we are going down. Again, we're still pretty high up here. I mean, that's a lot of cases in 1 week. Would be nice to get that down, but vaccinations, you know, with the vaccines coming out at the rate they're coming out, this should really help these numbers. If you look at deaths in the United States, we've had over 500,000 deaths, 540,000. Last week there were about 11,000 deaths, and the week before there were close to 14,000. So we are dropping. Again, this is quite at a high level still, and hopefully that will be dropping soon as well. For the world, there's 118 million cases, 2.8 million last week compared to 2.4, 2.5 the week before. So worldwide, there has been a little increase in the number of cases. And this is concerning because the more, you know, we can have the United States vaccinated and the cases can drop, but if there's a lot of cases out there in the rest of the world, it's possible that you have mutations that the vaccines may not protect against, or they may be more fatal, you know, so it's good to sort of try to work at a global level to reduce the number of cases worldwide. And the World Health Organization and a lot of countries are working on that right now. The number of deaths worldwide, we have 2.6 million deaths, and these are also going up worldwide, 61,000 last week compared to 59,000 the week before. So there's a couple things to remember. You know, South Dakota still is in substantial spread. 13% of South Dakota and 10% of Brookings County residents have tested positive for this virus. And among residents age 16 and up, 25% of South Dakotans and 19% of Brookings residents have received at least one vaccine. So you could think, well, we could add those together, like 13 plus 25, that's 38% of South Dakotans are immune to this virus. But we have to remember that many of the people who receive the vaccine also may be those who have tested positive. So you can't really just add these percentages. But I think what it is telling us is that, yes, you know, this number is getting high for the vaccines, but it's really not high enough, and that there are still a lot of susceptible people out there. The good news is that the age groups that have these poor outcomes have a high percent that are vaccinated. You know, close to 72% of the 80-plus-year-olds and 67% of that 70 to 79-year age group have received at least one vaccine. You know, those are the individuals that have a high risk of being hospitalized and possibly dying from this virus. The vaccination percentages do drop off significantly at ages below 70. And we have to remember that there's still long-term effects of COVID in those younger ages, even though they might not have the hospitalizations or the deaths. So now really is not the time to forget about the public health recommendations. And it's important to protect your friends and neighbors. You know, wear a mask, socially distance, avoid crowds, wash your hands, avoid those poorly ventilated spaces. You know, we're going to be needing to work together for quite some time, you know, to make sure that we can get this under control much better. So that's it for this week. Thanks, Chelsea.
Thank you so much, Bonnie. I appreciate all of the information. For those of you out there that may have a question for Bonnie, remember you can always email us at that email address that's listed in the description of this video, and we will see you again next week.